So this is a guide for all the students who are clueless about USMLE, what is USMLE and what steps they have to take in order to pursue the US residency program and to have a career in US. So basically USMLE includes 3 steps, step 1, 2, 3. You have to take step 1 and step 2. Step 1 is basically it's a basic science test. You can take it anytime after your third year, or you can prepare for your third year as well while you're preparing for your MBBS. Then coming to the step 2. Step 2 CK is a clinical knowledge, is a clinical skill test. You can take step 1 and step 2 anytime. Like you can also choose step 2 before step 1. It depends on your choice. So after taking step 1 and step 2, you have to proceed with the ECFMG certification, and you have to apply for the ECFMG certification. While you give your step 2 examination, after step 2 you are qualified for the ECFMG certification, and what you have to do next is you have to enroll yourself for the OET medicine, and then you have to apply for the pathway according to your medical history, like if you are graduate or a medical student accordingly. After you apply for the cycle, like the next thing is you can take step 3 before applying for the match cycle, and you can also skip step 3. Like you can, or there is a possibility then you can apply for your match cycle without step 3 as well. So step 3s are some kind of bonus, like it's a plus point if you apply for your match. So it opens the doors for more and more interviews like that. So what is the major and important thing that helps you out in your US journey is your step 1, step 2 CK and OET, and along with that pathway ECFMG certification, and the most important is US clinical experience. You must have minimum 3 months of or even 1 month of US clinical experience. So it's very important you should have a US clinical experience before applying for the match. So this is it. So the total match cycle, if we count about like in Pakistani rupees, you must have like expense of 40 to 45 lakh throughout the journey. Can be less, can be more, depending upon your situation, how you pass your exams, where you travel for your US clinical experience, and how many programs you apply for. So this is all, this is some I have tried to summarize the crux of USMLE pathway. Like if it helps you out, then it is very good for us to guide others.